Ah, my eye! Oh, it hurts so bad! Help me! It hurts! Today, the first aid procedure that I'm going to show you is how to treat a bruise. The first thing to do when treating a bruise is to check the victim for head trauma if the bruise is on their head. So, her bruise is right here, so the first thing you need to do is check for excessive bleeding if there's an open wound. And there doesn't seem to be an open wound, so she's good right there. The next thing you need to do is check for loss of consciousness. Are you here with us?
Yes.
Okay, so she's good on that one too. The next thing you need to check for is interruption in the breathing pattern. Is your breathing good? Her breathing seems pretty normal, so she's good at that one too. Okay, the last thing you need to check for is prolonged disorientation or memory loss. Ma'am, what is your name?
Shelly Lugren.
What were you doing whenever you were injured?
Playing baseball.
Okay, so she seems good there. So I think that we're good with head trauma. There's no head trauma with this victim. Okay, so the next thing you need to make sure that you do whenever you're treating a bruised victim is that the place that was bruised is elevated. So it's on her head, so she's pretty good right now. The next thing you need to do is make sure that you apply some ice to the bruise. I'm going to wrap this ice pack up in a cloth so that it doesn't hurt her eye. And we're going to leave her like that for 30 to 45 minutes. And depending on how well her bruise heals, she can repeat this for a few days until the bruise goes away. That's how you treat a bruise.
Samantha, help me, my nose is bleeding.
I know what to do. The first aid procedure I'm going to show you how to do right now is how to treat a nosebleed. The first thing you need to do is wipe away the excess blood. Okay, once that's done, make sure that you keep the victim's head level and make sure you don't lean it backwards or lean it forwards, because if you do, it'll make the blood flow increase, so you just want to make sure that it stays like this. Okay. Also, you're going to want the victim to spit out any extra saliva that they have, because if they swallow it, it might create nausea. So. Okay. Keep your head up, okay? Okay. Also, you're going to want to pinch the nostrils and push the tip of the nose to the bones of the face, like this. Okay. So this is supposed to stop the blood from flowing. You're going to want to do this for about 5 to 10 minutes so that the bleeding stops. And after the bleeding has stopped, you're going to want to remind the victim to not blow their nose or strain anything so that the bleeding will not start again. Also, if the bleeding doesn't stop, or if there's an excessive amount, or the victim feels faint, then you might want to call 911 or go to the emergency room, because that might be a sign that something worse is wrong. Okay, so that's how you treat a nosebleed.